I'll never forget this. Like, just like, like coughing. And when I say that lube shot and hit the nurse in the face, I will never forget it. And I'm over in the corner, like, you're trying to stay calm. And I'm like I'm trying not to laugh.
I had 13 ventilator patients on my very first shift.
Yeah.
No training.
Yeah.
So I literally had to think, like, a year ago when I was learning about this in school, what did they tell me?
It's been days where, like, I've terminally extubated 7 people within a 12-hour period. And then I drive home and I'm, like, in silence. And I'm like, yeah, like, what? Like,
I don't
what
listen
just
to music
happened?
on the way home.
Welcome back to season 3 of the Device Girls. Today we have on 2 lovely guests, Shay Johnson and Alexa Davis. They are both respiratory therapists, and we are so excited to deep dive into all things respiratory therapy, learn about their journeys in schooling, and then kind of what their day-to-day looks like in different markets. Alexa's from the DFW area, and then Shay is from Abilene. So we're so excited y'all are on today. Haley is joining us virtually because, well, sickness, the plague has just run through all of Abilene and Dallas, apparently. So thanks for joining us, Haley, virtually. I hope you're feeling better.
Hi, guys.
Hi.
Hi.
I look a mess, but I'm here. So excited to be here. And
We're so excited. Okay, Shay, why don't you go ahead and introduce yourself a little bit?
Okay. I'm Shay Johnson. I have been an RT for, I guess, 5 years, starting my 6th year. I've worked everywhere. I feel like I've worked in Sweetwater, Lubbock. I did a travel assignment in Fort Worth. Currently work here in Abilene. I teach respiratory students at the college. What else? I have my neonatal specialty credential, my bachelor's degree in respiratory, and working on my adult critical care specialty.
Oh my gosh, awesome. Very cool. What about you, Alexa?
This is what sorry. I've been a respiratory therapist for 3 years, starting my 4th. I worked in Lubbock, did a little bit in Abilene, like while I was in school, but now I work in Fort Worth.
Okay.
I did a clinical instructor in Lubbock for a little bit before I moved. I have my bachelor's degree in healthcare management, and I'm working on my adult critical care.
Awesome. Okay, talk a little bit about adult critical care. Why we're now stepping into that and pursuing that. What does that look like?
You gonna go?
So are you talking about like the credential or just like us working?
Or like why we want to do it?
Yeah, why?
The adult critical care specialty is like a lot of advanced knowledge.
Okay.
And it kind of helps us understand the nursing side of things too. I don't know if you've read the book yet, but
I've
there's
read
a
the book.
lot
There's
of
a lot.
medications in there.
Yeah.
And
It's
things-
almost like I would like to say like the nursing, like a CCRN.
Okay.
I think it's like an equivalent comparison, except it really hits a lot of mechanical ventilation advanced.
Okay.
So it kind of, I think a lot of people don't know that we have to also know a lot of meds
Yes.
that are given, like a lot of cardiac meds.
We share a lot of responsibility with the nurses. So
Okay.
yeah.
So walk us through a little bit of the schooling and what that looked like to become a respiratory therapist.
So you can either, it's kind of like nursing. They're like a 2-year ADN program or it's a bachelor's level program. So here you can go to Cisco for just a 2-year degree. Me and her both did that. And then you can go back and get your bachelor's later, same as nursing. Or you can go to like a different college, a big university, and do a 4-year degree. And then if you want specialty credentials, you have to have your RRT credential first, and then you go back and retest for specialties.
Okay. What did the course and curriculum kind of look like? Was it a lot heavy on clinical, or was it a lot more on the
pretty
bookwork
heavy on
study?
clinical? I know Shay had a completely different experience because she was doing it like doing her clinicals right at the end of COVID.
Yeah.
And I started right in the middle of COVID.
Yeah, we do clinical the whole time.
Really?
Through school. Like nursing kind of like breaks theirs up. We were in critical care the whole 2 years.
Yeah.
Okay.
And we start from like, I think we started school in August, and by October we were hitting clinicals.
And drawing blood gases.
Drawing
like
blood
sticking
gases,
people.
like in the ICU, doing critical rounds.
Okay.
So
Wow.
we get thrown in there pretty quick.
Okay.
how long are clinicals?
We did 12 hours.
Is that what we did? Yeah, 12 hours.
We did
clinicals.
3 12-hour days
A week.
Okay.
a week. And we did clinical blocks. We had switched ours. So we did like 3 weeks of clinicals, 3 days a week. And then we would do like a week of class and then go straight back into clinicals.
The students kind of do that now too. Like they're doing 8-hour shifts, but they're doing 3 8-hour shifts, and then they have 2 days of class, like in lecture.
Okay. So what is some of that class coursework will look like, or like specific classes that you take?
So we really hit kind of, we do like an, intro to respiratory care, like who started it, go back to the founders, like everyone does. And then we really hit on, intubation really quick on, life support. And then we hit pharmacology. And then we kind of switch over into adults a little bit, like adult, like mechanical ventilation. And then we did a lot of pediatrics as well.
Okay.
Yes.
And we have a course over that.
Okay.
They started changing up the the coursework a little bit here recently. They made a new like critical care class.
Okay.
And it has to do with hemodynamics, kind of similar when y'all were talking to the perfusionist, a lot of like how that cardiac stuff works. And then also, let's see what else. They're doing a lot of, like she said, intubation. We're having to do clinical checkoffs. Like they finish their semester and then they have to like physically show us how to do all the skills. So that's what I just got done doing. And they can't move to the next semester until they are checked off on all skills.
Okay. Wow.
Mm-hmm.
Yeah. I have a question too, this is kind of not related to education, but I want to know like what inspired you both to go into respiratory therapy. And you can do that after you're done with the education part if you want, but.
Well, for what inspired, like truthfully, I had no idea respiratory existed. No idea. You don't know until you know. And honestly, me and Shay, we went to high school together. We were working at a restaurant together, and I'd gotten accepted into nursing school. And I was a little nervous. I was like, I don't know, something doesn't feel right. So I like rejected it. And I was like, I don't know what I want to do. Shay was already in school, and she'd come talk about like what she was doing, and it seemed so fun. And I was like, let me take a little peek. And I did, and I was like, okay, it seems like something that I could do.
Yeah.
And then I started to get into it, and honestly, I've loved my job ever since. Like, I don't have any regrets about making the switch.
Good. What about you, Shay?
Honestly, I don't really know. I was 17 when I started respiratory school. So my mom,
oh my gosh.
Yeah, my mom just kind of told me like, hey, when you graduate high school, you should apply for this program. I didn't even know what clinicals were. I did not know anything.
Yeah.
So then whenever I got to school, I had 3 clinicals. I had already been in a code, done compressions on somebody. And I was like, I think I really like this. It wasn't even until after I got into the program that I knew what it was. So,
wow.
Yeah.
That's crazy. Our industry as well. I mean, it's so crazy. Like in high school, it's like all you know is you can become a doctor and you can become a nurse. Like those are like
100%.
Yes, we get called nurses all the time.
Yes.
Oh, I don't know how many times I've gotten called a lung nurse, and I'm like, you know what?
That's okay.
It's okay.
It's better than just like, hey, can you get me? Can you change me or put me back in the bed? I'm like,
Actually, I don't do that, but like, I definitely will find a lovely gal that will help you with that.
Yeah. Well, or and the CNA, right? Yes.
It's really sad because there are so many different like great career fields and different avenues that people can go into, and they don't talk about it or like. I feel like they're doing a better job with schools, like with high schools. I mean, I know a lot of them here have CTE programs and stuff, but like that's all we knew growing up was like nursing, doctor, or
literally
like
there's so many disciplines.
I wanted to be a vet first. Like that was a completely different path, but before that it was like orthopedic surgeries. But it's like doctor, nurse, vet. Like that's it.
Lawyer. Like they really hit all of like the main like I don't know, like primary categories, but you like there's all like other people that like really blend everything else together that you don't really know about that are in.
It's like everybody has their specialty. Like every day we work with PT, OT, speech language pathologist. Who else? The PCTs, like the nurse techs, the nurses, the PAs, the MPs, the doctors. Like we work
CRNAs,
with everybody.
I work with ECMO specialists. Like I mean, we're kind of like in there. We work with everybody.
Oh yeah, Lubbock. There was a lot of ECMO specialists.
Yeah. It's crazy, and I think like. It's doing such a disservice because I feel like that's one of the hardest gaps when you get to college or like when you graduate high school. It's, oh my gosh, what do I want to do? Like, I mean,
when you're 17.
Yeah. But
I have no idea what I want to do.
With such a lack of knowledge of what all of the options are out there to start to jump in and try to
actually started here in Abilene doing career days, like going to high schools.
Awesome.
So we have some like RTs at the hospital going to high schools and doing career days. And so is nursing. And I think PT is doing that too.
Okay. I think
that's awesome.
Brittany Olsen told me about that.
Mm-hmm.
That's awesome.
Yeah, so they really get to see. And then we also do you remember when we used to do like the high school students would walk through the auditorium and they'd watch us intubate and they'd watch us bag somebody.
It felt so cheesy because you're like, oh my gosh.
It was, but at least we got 2 students
cool.
out of that who applied to RT school.
That's
yeah.
awesome.
I feel like every single day I realize how cool my job is.
Yeah.
You know, like something happens and I'm like, oh my gosh, that was so cool.
Yeah.
Yeah.
Absolutely.
Like you re-fall in love with it all over again.
I
You're like,
know.
glad I did that.
Yeah.
Love it, do that.
Especially on the hard days, like when you forget and you're like, why am I doing this? But then you just have the best days and it's like, this is why. This is why. This is why.
Absolutely.
Yeah.
Like that too.
Cool.
Yeah. So on that note, what does a typical day like look like for you guys? Kind of walk us through your day to day and what that looks like.
Well, it's completely different wherever you go.
Yeah.
I've worked in a lot of different like areas. I've worked in a burn ICU. I've worked in a trauma surgical ICU, cardiac, neuro. Right now I'm in like a medical ICU. So it's a little bit different. But as respiratory therapists, like we take on a lot of patients at a time, like 15 to 20, sometimes even more than that, or the amount of people that we are seeing and we are treating. I like to say the easiest part of my day is giving a breathing treatment. Like that's the easiest part.
That's like our busy work.
That is like busy work, but like that's what a lot of people like only know us for. They're like, oh, y'all just give breathing treatments. And I'm like, honestly, that is like the best part of my day is when I can just give you a breathing treatment and we can have a good conversation and you feel like you're breathing a little bit better and then I can go on to the next thing.
Yeah. You're not coding.
We're not coding. We're not like putting anybody like on a ventilator. You know, we're not terminally extubating somebody for, you know, being the last face that they probably see in that moment. Like, so our job differs from like something very like minute to something extremely serious. Or when we're cannulating for ECMO, we're typically in there bagging the patient until they can get them on cannulation.
Okay.
Just depends on where you work. Like I'm a NICU therapist and I also work PD.
Sorry, the babies.
And then I also work adults here in Abilene. So I do a lot of different stuff. Honestly, I could literally go from going to labor and delivery for a high risk pregnancy to an adult code in the ER, a trauma that came in.
Yeah.
So we do a lot of different things. We try to stay in our area, like whatever your assignment is for the day, that's your assignment. But for example, ICU, we do rounds every two hours.
Okay.
So we see our ventilator patients every 2 hours. We're typically giving treatments, like breathing treatments every 4 hours, depending on the patient. We do a lot of therapies, like CPT.
Can you
we want to
walk
improve
us
lung
through
function.
what those acronyms stand for? Just
sorry.
No, you're good. You're good.
I just like everyone should know exactly what we're talking about at all times.
That's fine. So chest percussion therapy is like to help move mucus out of the lung wall, like the wall itself, up into the airway so they can cough.
And we can like suction it out if you're intubated, or you can.
Okay.
We do. It's kind of hard to explain, but most of the time it's just improving lung function. However we do that.
Okay.
So
lung
it's
expansion.
Right.
Okay.
It's like lung clearance therapy, whether that's like suctioning or we give certain nebulizer treatments that help decrease the thickness of secretion. Just kind of sounds gross, but
oh, I love it. What are you talking about?
We take care of trachs. Like we take care of all the trachs if you've ever seen one. All the trach care.
Or Larry patients that have like all of their anatomy like taken out up top.
Wow.
And like that's their primary way of breathing.
Oh my gosh. I'm like mind blown right now.
I do feel like so the other day, that's kind of a funny story. We have like NICU and PD nurses now here in Abilene like following us to shadow us before they're allowed to be on their own so they can kind of see all the disciplines. Well, we had a PD nurse following me and I had a very interesting day, like lots of traumas and I had trach patients and we went to codes and we went to rapids. She told me, she's like, I did not realize how much y'all did. I really thought you were like oxygen techs. Like, we thought you just came in, checked their oxygen and left. So they're starting to do that because we kind of started to lose some respect. So now people shadow us. And it's funny because she was like, y'all walk a lot. And you have like your steps in. She's like, we saw 40 or 50 patients today. And we were doing compressions. We were bagging. We were intubating. We were going to rapids, putting people on BiPAPs. We were so busy. And she was like, I cannot believe that. She's like, y'all are like superheroes. You come in, you save the day, and you leave.
Right. So most people, like when they're seeing us, they don't know they're seeing us, you know, because they're at that point where it's not a good situation. Yeah. Because like in Lubbock, they had residents that would follow us for a little bit. and he'd get weird, like, doctor's following me. That's a little weird.
Yeah.
But like, they would, same thing. They'd be like,
I
I honestly had no idea that like
Y'all did
you're in
this.
there every single time. And I'm like, I'm right next to you, baby boy. Like, I'm,
Yeah.
like, I'm right here.
there's
You know, like,
something- I'm
you're
just saying-
intubating. I'm holding the tube. We're bagging. We're making
If
sure
you
that
see
airway's
a-
there. Like,
I love
I'm
it,
right
yes.
here.
Yeah.
If you see us in the room, something's not
Yeah,
good.
something's not right.
But I mean, it could be something minute, like a treatment
be,
or
yeah.
something. But for the most part, we're critical care.
Critical care. Yeah.
Wow. Okay, so like how many of you are on the floor or staffed for a day to where, I mean, because there's no, like, if you're paged to 5 different, like,
Yeah, no,
traumas
there's
or
so-
codes
we
at
have
one
10 to
time, like,
15 here
Okay.
at Abilene at
Okay.
a time. I don't know what we're.
So Lubbock was 15 to 18. Fort Worth
Oh,
is a
yeah.
little bit smaller. And we have like, we staffed 12 yesterday.
okay.
That's about.
It's about
average.
average. I mean, it depends like on our census, you know, like, because
Yeah.
like every room, they get a nurse and they get like, you know, a CNA, you know, like they get somebody like that. Like we're a specialty. So like you can have people on room air that are just there for like some abdominal pain
Yeah.
and they don't get our services.
Yeah.
So like we do fluctuate on
kinda,
staff.
like peek in and
We
say,
peek
okay,
in
you're
and we're
good.
like, okay, you know, you're good, you know,
Yeah.
but like they don't always get our services. So our services are,
Yeah.
that's where our specialty comes in. Is like not everybody
That's
gets
a
a
really good
respiratory
point. Yeah,
therapist.
not everybody sees us. So
Okay.
I think some people don't realize that we're like there until it's like
Until we're there,
something crazy,
you know, until we're there, and they're like, "Where's respiratory?" And you're like, "I'm right here." Like,
Yeah.
we are.
Absolutely. I will say in code situations, like here in Abilene, we're in charge. It's
Yeah.
kind of how it's been. Like it's
Really?
like who's keeping time? I'm gonna do compressions. Okay, this person's bagging. I feel like we kind of take over, and then
Wow.
especially in ICU, the nurses take over too. Like we're like a team.
Oh,
It's
well
like
organized.
I like to say it's almost like an organized symphony. You know,
Yeah.
like there's chaos going on, but
Mhm.
like that's what I loved about working traumas and in the ER. Like I'm an adrenaline junkie.
Me
Like
too.
I loved
Yeah.
it, you know. But like it was like before a trauma would come in, like we'd all stand around and you know the doctor would be like, "Okay, guys, like this is coming in. Everybody tell your role. Boom, 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 boom. Okay, everybody's here." And like as soon as the patient would come in, like
Yes.
we wouldn't really be talking, but we were talking and everybody was doing their own thing.
Yeah.
As the doctor's calling off, like, have we done this? Have we done this? And we're just all like working together. Nobody's really in your way, but you're all like
Right
stacked
next
on
to
top of each other. Like
Yeah.
someone is always in your bubble, but like
It's
you're doing
so
your
nice.
thing. Like
yeah.
it's
Yeah.
just like an organized symphony. Everyone's, you know, like your trumpets are coming in, you know,
But
like
if somebody
yeah.
was watching over the room, they'd
they'd
be like,
what is this chaos?
Yeah.
Like
I
how
do
how
like
do they
that.
all know what
Yeah.
they're doing without talking to each other out loud of
Yeah.
what they're doing? And I'm like, because you just know your role. You go know your role, you do
It's
your
nice
thing.
because then you
Yeah.
see the people that you work really well with, and you know it's going to be a good.
Yeah,
day.
you're like,
because
oh,
you
this is
know,
gonna be
like
good.
they're going to think about something without me even saying it.
Yeah.
they're
like,
anticipating
they're
my
in
move.
lockstep.
Yeah.
So how did that like training look like for you to really get that down or just start to
Like,
understand
like
the
after
dynamic?
after school,
You get
Yeah.
thrown in.
you
there.
get thrown in there.
Okay.
You
and,
really like you're with somebody. Sometimes, like when I graduated school, it was during COVID. I had no training, no orientation. I had 13 ventilator patients on my very first shift.
Yeah,
No training.
Oh,
yeah.
So I literally had to think like a year ago when I was learning about this in school, what did they tell me? But it's not like that now. I mean, you get proper training now, but yeah, you pretty much just learn from
Yeah.
chaos.
Yeah.
You learn because something happened to you and you're like, okay, next time I know.
Yeah, you're like, I will never do that again.
yeah.
Like,
But the good thing about respiratory is like, if you don't know, we can just bag them. If something's going on with the ventilator or something's going on, you can always just bag and
oh,
breathe
that's
for
what I
the
tell people:
patient.
when in doubt, bag it out. Bag it out, baby, until you can figure out like what's going on.
Yes.
Like, why is it making that
Yeah.
noise? Like,
If you don't know something, at least we have a little bit of like a backstop. Like we know we can just
Yeah.
bag them for a minute. Let's think about
like
this.
this. Let's get like circle
Slow
back to like
down.
let's like
Yeah.
circle our thoughts around.
I'm
But,
sure
like,
anesthesia does that sometimes.
oh, they
too.
probably
Like,
do. 100%.
Just
I would, you know, but
Wow.
yeah, no, like my first day, like I had 7 vents, but like it was a totally different environment. It was something I had never really seen. Like I had done a clinical rotation there, but like,
IUMC.
yeah, like,
Gosh.
and I literally was scared to death. I didn't cuss there. You should be proud. I was scared to death, but also it was so exhilarating. Like I remember I was with my preceptor, love her to death, and she
Mhm.
looked at me and she was like, "Okay, you're with me all day," and I was like, "Okay, cool." I had 2 patients code at the same time, and she looked at me. She's like, "You're on your own," and I was like, "Oh, okay." Like it was my first time,
Yeah.
like me, and they're all looking at me like, Alexa, what do you want to do? And I'm like, oh, I want to, like, I'm going to do this. You know, like I'm talking to the doctor and in my head, I'm like, like I'm breathing as fast as like everyone else. I'm like,
You're like, I'm
act calm.
hyperventilating right now.
And like, I'm hyperventilating and I'm like, okay. And then like, after we were done, like, I was like, oh, oh my
I'm
gosh.
a boss. I did that.
I do
I'm
think,
just
like,
a baby and I just did that. And I was like, ever
Yes.
since then, it was like a high. I was like, I can do this. I know
Yeah.
exactly what I'm doing. I am prepared. There might be some times where like
you gotta ask.
a different situation comes up
Yeah.
and you're like, okay, that's a different
Yeah.
situation. I've never dealt with that. But like, you just like, you trust your instincts and you trust like what you learned. Like,
Yeah.
honestly, a lot of my mind goes back to our books and our schooling. And it kind of feels weird when you're like, I have a photographic memory. It's like, I feel like I'm flipping through a page. And I'm like, okay, I remember seeing that. Okay. Yeah. You know, like,
Yeah.
and so like, I don't know.
Honestly, don't even know what goes through my mind. I get so focused.
You
If
just
something is
know.
going on, I
Yeah.
don't talk. Like,
Do you have
I'm
a
just
song
like,
that plays in your head?
yes, or a song. Or I just don't
Have a
talk. Most of
shuffle.
the time, like, I get so zoned in and I'm like, I
Oh.
instantly know, like, oh, we're missing this. Oh, can somebody go get this? I'm like, I'm very bossy. So I know,
But
like,
you do
whenever
not
I
get
get in there,
that vibe from you.
Huh?
Like, I don't get a bossy
that's
vibe.
cute. That's cute.
I don't know. I'm just like, I think I'm just very like stern and I come in confident
Yeah.
and I know what needs to be done.
Yeah.
So,
Which in those
It doesn't help that
situations,
she has a
you
great
have to.
RBF, you know?
oh my God. I'm like, I should wear a hat or like a stethoscope cover that says, I'm really not me.
Excuse my RBF. No, I have
I'm so
my badge
sorry.
right now. It says resting witch face. I've switched to my holiday ones.
That's
So-
true though.
So funny.
I think that's like mask help with that a little bit when we
Yeah.
were wearing masks.
Yeah.
But now it's just like people know me now and like they know that I'm just, my face is,
Yeah.
you know, zoned
Yeah,
in,
you get with
but-
your people and they're like, she's fine.
Yeah.
So, I'm not
Yeah.
mad.
She's real nice.
Yeah.
I have a question. So
Okay.
you guys were talking about like trauma and
Mhm.
everything and how exhilarating that was, but do you guys have like one patient story each that like really stuck with you guys from that time or that stuck with you just in general that you could share with everybody?
That's funny because they were talking about that before this started, and we were saying like we both have like Rolodexes of patients that like randomly will pop up. Like I'll remember their name, I'll remember their face, like
Yes.
I won't ever forget.
Mhm.
But like I feel like they're all traumatic, clearly, but
Mhm.
I feel like it's like the situation that happened to them and like making sure like in my heart that I know that I did everything that I could to save their life.
Mhm.
Like everything that I could. Like we had a patient that came in and it was a gunshot wound to the abdomen, playing in the backyard, I guess, and the gun had gone off. From the second that patient hit the ER, they were blue stripped, which is like at a certain amount of time that we have to get them to the OR. I think it's like under 30 minutes we have to
Okay.
get them to the OR. And typically they'll call coming in like, we need the OR prepped. Like
Yeah.
it's not looking good.
Yeah.
We came into the trauma bay real quick, patched what we could, like held pressure, intubated, got a breathing tube in, and then they went straight to the OR. They were in the OR for like, I don't know, maybe like an hour. And then they came back out and they couldn't stop the bleeding. Like
Mhm.
they tried, they couldn't stop it.
Mhm.
Like as much blood product as we were putting in was as much as was coming out.
Yes.
And we the family was about an hour out, and so we're like, okay, well we all we can do is give blood. Like we can try our best. Like all we can do is try our best to keep the patient stable until the family can get here. And we tried to put the patient on the ventilator several times and could not tolerate, would drop to a SAT of 20%. And we're like, okay, so we have to bag. So I bagged for about 4.5 hours.
And that is literally
By myself,
sitting there,
just sitting there at the head of the bed,
Mhm.
just bagging. And the nurse was coming and giving blood product and everything. But like the patient's room was like quiet and still. And like I was just sitting there looking at the patient, like just thinking like they're looking at me. Like I don't know what they can see. I don't know what they can remember, but they're looking at me. And all I don't know. I just patting their hand, like it's gonna be okay. Like I'm here, you're okay. And then like when the family was able to come in, like, you know, nursing stepped out, but I can't leave.
Mhm.
I leave, you like
They
patient would
suffered.
have stopped breathing. And I remember the attending, like he cracked the door just enough and he was looking at me, he's like, you're okay. He just kept looking at me, he's
Yeah.
like, you're okay.
Yeah.
And as that, I was like, that poor mama was just like, that's my baby. Like, that's her whole world. Like, her
Mhm.
world changed in an instant. Like,
Mhm.
their life was
Mhm.
never the same again. And like,
Yeah.
like,
Unfortunately,
and
that
unfortunately, like,
happens
I was
so
the last
often.
face that they saw, and they're looking at me like,
Yeah.
can you save him? And I'm like, I'm doing everything that I can right now. Like, that's about all, I'm doing about is
Yeah.
all I can do. And, you sit there and like, at the end when, they finally understood that like, we're at like, kind of like at the end of what we can do. And they were like, okay, we'll let him, go peacefully. And, like, you're in there and you take that breathing tube out. Like, I know they don't mean to look at you that way, but like, they look at you like, you killed our baby,
Yeah.
like because we take that breathing tube, like, that's
Yeah.
the last thing, like, what more can you do,
Yeah.
So,
Yeah.
and then like, that's the unfortunate part of our job is like, you're in that room, you're in there for 4.5 hours, but you wipe your tears, you suck it up, and you go to the next patient room that they're yelling at you because you're 30 minutes late for their breathing treatment that they were expecting. And
That
you're
is
like,
the worst part,
and,
yeah.
and you
People
know,
don't
and you like,
understand.
you keep it together because you're like, they don't understand. And then like, you could have another code that happens. And then that one kind of, it turns out okay.
Yeah.
But like, there's been days where like, I've terminally extubated 7 people within a 12-hour period. And then I drive home and I'm like in silence and I'm like,
Yeah.
like, what? Like,
I don't
what
listen
just
to music
happened?
on the way home.
No, I like sit there in silence because I'm like overstimulated. And I'm like, how many people did like, they like, I don't know. It's just,
Yeah. Wow. That's
I don't know.
really hard. See, and I didn't recognize that. And actually, I really appreciate you saying that on like the, you walking into the next patient and
To act like nothing happened.
you have to act like nothing happened, but also like that patient has no idea what you just came from. So
No.
like the same perspective from like the staff, like not knowing like, or medical professionals not knowing the backstory of patients and like sometimes their irritability or how many times they've had a hospital visit prior or, whatever. The same with the patient to the medical professional. Like you have no idea why they're running late, what just happened. Like just show grace in those settings, because it is like, it's hard. Our days are hard. What about you, Shay?
I have a lot of stories. The one that I will never forget was, COVID was really, really difficult because they couldn't have family members. At the beginning, it was just like they didn't want to spread infection, so nobody could really have visitors. So we had a 19-year-old kid come in. Coding, had lost the pulse for a long time. I don't know, over 20 minutes. He got to our ER. They knew he was poisoned in some fashion, was found at the bottom of like a H2S gas tank.
Oh my god.
So he pretty much, that toxin is in their bloodstream and there's really no way to get it out. And so we got him to the ICU. The family really couldn't come in very much, like only one at a time because of COVID restrictions. And he had like younger siblings. And we were doing compressions on this young man for hours to keep him alive long enough to let the siblings come in. And like she said, I was the last person on his chest doing compressions. And when like they called the code and I got down off the bed, it was like the family was looking at me like, you didn't save him. So that was really hard.
It's the mother's cry for me.
It's always the family members. Like if there's no family members in there, I'm normally okay. I can hold it together. But it's the family members. Like you can see, like their whole world is just
that's somebody.
Yeah.
Like that's somebody that turned their world.
Yes, and all of this happened because he wasn't wearing a mask the right way. Like it just a little bit got in his mask, and so he was following all the rules. He had a little 5-year-old brother that was like on the floor, like beating on the floor, like I couldn't do it anymore. So I had to leave. Thankfully, there were other RTs in there. I came back, and the family's like, can you just say a prayer? And I literally was like, oh my gosh, like, I don't know if I can hold it together. Like, sure. Like, and I did, and I'll never forget that.
Wow.
And of course he passed. Like, there really was nothing else, but I have a tons of stories where like we intubated a COVID patient, no family members. Like they're like, can you just hold my hand? Like anything.
The COVID patient.
Mm-hmm. We had no family, and it ended up being the dad of a girl that I went to high school with. And the last thing he saw was me holding his hand. Went on the ventilator and never woke up. So
Wow. How did, I'm sure COVID like was very chaotic for y'all's jobs and just with like everybody having COVID. So how did COVID like affect your roles and what did that look like for y'all?
I think our job roles got much more important. I think a lot of like respiratory was much more respected. We did a lot during COVID, and I feel like the nurses felt like they were kind of hands off unless they had, because they didn't know like how to help these people. They were on all of our breathing devices. I think we earned a lot of respect, and I think it changed respiratory. We were on national news. We got a lot of pay raises during that time because I started in 2020, like right
when COVID
was all going on. And so, yeah, I think it helped us tremendously. And RT, like applications to get into school were significantly higher.
Really?
They've doubled.
We became like what the top 4 or 5 like wanted or desired job at that time.
Yeah.
Wow.
Yeah. Before, like, I think we were pretty low on the totem pole because, you know, unless you've had asthma or something, not a lot of people knew you existed.
Yeah.
You know?
Right. Yeah, it definitely put us on the board for everybody to be like, okay, yeah, I want to do that.
What was that mindset like, especially for you going in like during the COVID time of this is so unknown, right?
It was
this
just
so
survival
scary,
mode. I honestly didn't know. I was so young. I was 20 years old, taking care of people, like acting like I knew. Talking. I mean, of course I knew, but I had no orientation training with a therapist, and so I had to get that confidence. Like I had to go home and study. There was stuff I literally had to go home and be like, okay, I need to look at this because I didn't know at work. It was just really, really hard, and a lot of people were traumatized from it. I'm telling you, some of my coworkers are so hardened from it that they just like do not care about anything anymore. No one gets upset about anything. And that's the hardest part is like if you feel emotional about something, like you were attached to a patient, everyone's like, it's not a big deal. And then they go on about their day. And I'm like, no, like I'm still like, you know, you ever get like that?
So like, that's funny
like
that you
everybody's
mentioned
so
that.
hard
Like
about it.
I had picked up a ton of shifts and I was working like a ton. So like I was fortunate that like COVID was like at the end of my clinical, so I got it with like another therapist. But the hospital that I went to after that, like I chose the trauma surgical route, so we only got like maybe one COVID, but you were mainly like car accidents, hangings, gunshots, like limp, you know, like car, you know, like I only saw those people, so it definitely was a different. But like you've seen so many traumatic things, and you see things that are like, this is what people write about in books, or this is what scenes and movies, but I'm seeing it in real life. And you know, you go day to day, and it got to a point where like I would work my days, and on my days off I'd go home and I'd sit in the dark and sleep, and I had contributed that to being like, I'm tired, like I'm just tired, like whatever, I'm tired, you know. And then it came to the point where like I went to therapy because like our job was like, hey, like
I definitely should have gone.
It's you know, y'all work in a trauma, like in the trauma area, we would like y'all to go to therapy. And so I did. And I was like, you know, I blew it off. I was like, it's therapy. Like, I don't need therapy. I'm fine. And I got in there and, you know, she was like, you understand that as a human being, like when you're younger, you understand the importance of permanence. Like as a kid, you know, you'll take the toy away, they'll forget about it. And they get to that point where they get older and they understand that objects have a permanence in this world. So you've learned that at a young age, and then you grow up and you're dealing with these traumas and like these people, they have permanence, and you're watching the light leave their eyes. You're watching it glaze over as you're sitting there bagging them. And then you go to the next one, or you go to the next one, and you just keep pushing those feelings down. Like I mean, my personality has definitely changed, and I think it's really like sad.
True. I feel
sad.
like
I don't feel like I'm the same person that I was. Like
I feel like emotions are so shoved down. Like I feel like I'm like there's no reason to be upset. Like I feel so hardened. That's the only
but like
word
I think that like I've changed about minute things. Like other things that like are very like super serious to somebody. Like, I don't know, like I
Like,
got a
I'll-
dent in my car and I'm like, okay, well, I saw someone die today. You know what I'm saying? Like, that's just where my mind goes. And
Yes,
I'm
I'm
like,
like that too.
I'm
I'm
like-
like, your problems are so small. And it's
compared to
not
like the
their
grand
fault.
scheme.
I'm just like feel that way, you know?
Yeah.
Like I saw something at work and then I go home and my husband complains about one small thing at work and I'm like, I literally don't want to hear it.
Yeah.
And I don't say that to him, but I'm thinking that. And I'm like, you know, he doesn't deal with what I deal with. So I need to like validate
also what
other
a-
people's feelings.
But also, what a
because-
blessing that he doesn't, because
Yeah,
like I
that
think it
too.
does take like such a special human being for all of us to be like, I chose to do this. I didn't necessarily sign up to see people pass away. I didn't necessarily sign up for that. Like we definitely all signed up to save a life, make a difference, make a change.
Mhm.
But on the flip side of that, like this is like the sad reality, like that we do see that, and I think like what a blessing it is that like not everybody has to see that. Like we're taking that burden onto ourselves. So that way they don't have to feel that, like they don't have to see that, they don't have to deal with that.
Yeah.
And so like I think like like that's what she told me. She was like, you know, think of what you're doing. Like, yes, it's hard, but think of like what a blessing you truly are to people.
Yeah.
That they don't have to see the harsh sides of it. Like they
Yeah.
don't have to see that. Like you're kind of like almost like a shock absorber. Like you're absorbing that.
Yeah.
But like also like we have to have an outlet so that way someone can absorb like
Well, and you
everything
can
that we
release,
have. Like we need to
Mhm.
release.
not to hold it in. Yeah.
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 Wow.
Definitely have to like decompress on my days off and do happy things and talk about my feelings, because if I go to bed and I like feel a certain type of way, my husband can always tell. He's like, no, you're not going to bed. Like, what happened? You know? So I think talking about it for sure. I wish I would have gone to therapy, just considering that like we were coding 4 to 5 people a day during COVID. Like everybody was dying. It was just so sad. And there was no family members in there. Like they're literally all that you have. Like they were like clinging on to my first and last name because they're the only person that I know.
Yeah.
Like they know they
you
knew me by
became their
name.
family.
Yeah.
You became
Yeah.
their family. And
And they were there for weeks,
yeah,
if
and
not
like
longer.
and like we had a program up in Lubbock that like it's called No One Dies Alone. So it's like these volunteers that literally like they come
Oh,
in
that's
like when
super cool. I
someone
didn't
is
know that.
passing. So no one dies alone. Like you're not left in a room because you know sometimes families can't make it, or sometimes you know people don't. They've surpassed it, you know, like, and so they come in there and they sit with them so that way they don't pass alone. And I think
that's beautiful.
that's another job that like you know, like you didn't even know that it existed, but I think that that's like
Is that just strictly volunteer?
I think it is. I don't know if some people actually get paid for that, but I just always thought like, because I know that like they had told us that like if like on our days off, if we ever wanted to like be like I guess like on call per se, like if you wanted to come in and you just sit there and you hold
It's pretty
their
awesome. I
hands,
didn't know that.
you play
that.
music, you know, you can play music and you just sit there and you be with them.
Wow.
Or like if someone couldn't come in, of course, like we sit in the room and like you're there with them. But like I always think like even yesterday I had a patient and I'm like I was cutting his food up and that's clearly not my job. But I'm thinking like I would hope that if this was
I do that
my
too.
dad or my
Like-
mom or my grandmother, that somebody would take like a half a second out of their day just
help.
to do something
Yes.
that like it might not be within their scope of practice, but just to take those nice couple of seconds and just be a human, be a human being.
I do that too. I don't like. I've seen a lot of therapists like the patient wants water or a blanket. They're like, "Oh, I'll go tell your nurse." I'm like,
And they walk
it doesn't
out.
take you but like 2 minutes to like go get them what they wanted, or hey, can you change the channel on the TV for me? I can't see the remote, or it's just like, and I plug patients' phones in all the time. Like they can't find their charger, so I'm like searching everywhere. Like I always get done with my rounds last for that reason
100%.
because I'm not
Plus,
gonna
I'm a
let them
yapper.
just.
I
Well,
yap.
yeah, I do too.
I yap.
But I'm definitely not gonna like wait for somebody else because the nurses are very busy too.
Yeah, like
So if I'm already in there, I'm like, yeah, we're just gonna do it. Or I show pictures of my dogs or my kid.
Yeah.
Some of the little grandmas, they just want someone to talk to.
yes,
And they're like, do you have any kids? And I'll sit there on my camera roll and just scroll. And she's like, oh my gosh. It just makes her day.
Yeah.
it
love
honestly makes
that.
my day too.
Yeah.
Like yesterday, I had a patient. I was taking the BiPAP out of the room because you know they did order got canceled or whatever.
Uh-huh.
And she's like, "Oh, yeah, thank God you're taking that out of there." And I was like, "You're welcome." And I was like, "Well, what are you gonna do the rest of the day?" I'm like, you know. And she's like, "Well, I'm gonna watch the Cowboys play." And I was like, "Oh, bye." And she was like, "What's that face?" And I was like, "Well, we both know they're gonna lose." And she goes, "I'm about to get out this bed." And I was like, "You get out this bed, girl. You do it." And then like I left and like Lab went in there to draw labs, and she's like, "Did you hear her? did you hear her talk to me like that? And I was like,
so funny.
have a good day.
I
She's
know,
like,
have a good day.
okay, like, I'll see you again. And I was like, just being able to have like banter with people sometimes, like, they're, like, they don't want to be in the hospital. Like,
most of the time
know.
they just want to have a normal conversation.
Yeah.
So I did try to make conversation. Now, most people are very grumpy.
I love the grumpy ones. Those are my
Yes,
favorite.
I'm like extra nice to them. I'm like, you're going to be my friend today.
Yes.
like, we're going to be besties. You don't
That's
even
how we
know
are
it.
with surgeons that like don't want to talk to us. I'm like mold. I will grow on you. I will kill you with kindness.
Yes, I'm the
just
same.
so
See,
like
I like to bribe my patients. I'm like, you don't want to do it? What if I do a little Irish jig? If I do a little Irish jig right now, like, will you will you continue on?
Can
that's
you please send us a video of you doing this?
That's
Yeah,
a
I
very
will.
true statement.
Like,
because
I will pimp myself out for favors. Because I'm like, I need you to do this treatment because you're not doing good and I don't want to see it go south. So like, what do we got to do? You want some swabs of water? We can make that happen,
we literally, like, all of our therapy is very, like, nobody wants to wear a BiPAP mask that's blowing air.
Yeah,
down
it's just
your
like,
throat. Nobody
like,
wants
flapping on your face. Nobody wants that.
Nobody wants you to be, like, pounding on their chest doing the CPT. Nobody wants to be doing the deep breathing, blah, blah, blah. Nobody wants to do
Nobody wants to do any
So
of
we
our
have to
stuff.
bribe them.
Yeah, you have to have, like, a little incentive, They deserve a bonus, too.
Yeah.
Sometimes it's
so
my
funny
Irish
how we
jig.
talk
I don't know.
There was one time I actually put a BiPAP on, like a brand new BiPAP, and I wore it for 10 minutes. So that
Dude, it's
doesn't
horrible.
work.
It's horrible.
And then I got a new start getting a new mask. I'm like, okay, it's your turn.
See, like, if I can do it, you can too,
Oh my gosh.
Yep, sure. I've
It's so
done that.
funny y'all are talking about this because my grandmother, which this is a whole story in itself, and I won't open that can of worms, but basically I didn't know her my whole life. But anyway, she went into the hospital. She had like some virus, but she has horrible COPD and everything. And so like basically my mom gets called. My mom hasn't talked to her in 20 years, but they're like, she is fighting, and she's an 85-year-old German lady. Like, okay, she's like fighting everybody coming into the room, but they were trying to do the breathing treatments with her.
Mm-hmm.
And like, she was throwing stuff at people. I don't know.
We love those. Love it.
I'm pretty sure that her respiratory therapists were pissed off at her.
Probably.
But yeah, so I know exactly what you guys are talking about. And we eventually got her to do the breathing treatments.
Yeah, it's like I hate that because most people appreciate us. Like the patients are like, "Oh, thank you so much," or they are counting on us. But most of them are really not happy with us.
Yeah.
What we're
'cause,
doing
like,
is not. Most of it's pretty invasive, especially suctioning. Like,
they'll do the eye roll. They're like, oh my god, they're back again, and I'm like, hello, I am back for your breathing treatment. And they're like, oh my god, and then you're like, sorry,
Yeah.
like I want you to go home too. Like
Yeah.
I want you to breathe, like but I think that a lot of patients that really enjoy us are like my tracheostomy patients and my laryngectomy patients.
Okay.
Like, I feel we like dab up. I'm like, let's ready to do some trach care, baby. Like, let's get you cleaned up, And then you're sitting there, you're cleaning it, and you're talking, just having a casual conversation, and the nurse is like gagging because you're like, you're going in there, you're suctioning, and you're like,
that is
having
very
the grandest old time, and I'm like,
most of the nurses are like, I could not do your job.
Yeah,
I'm like,
I
I
don't
could not
do
do yours.
I don't deal with poop.
Yeah.
I'll go in to do a breathing treatment, and like the nurse will have like the patient like cheek out, and I'm like, well, I'll be back. Like, yeah, I'm good. Are they breathing in there?
Time.
And they're just like, yeah, they're fine. Like, I'll be back.
I'm the same.
I'm good. I'm like, do you need anything? Like, I'll throw you a chuck, but like, I'm not physically touching. I'm so sorry.
That is
You are an
definitely-
angel, but I could never clean poop.
I have definitely gotten poop on me for sure.
I mean, but y'all are moms. Like, oh my god.
That is true.
Oh my god.
Yeah. I blessed Dustin because the poop thing and the vomit thing are not my
See,
thing.
I can deal with vomit. I've been thrown up on a couple of times.
No, not me.
I mean,
I've been
it was
projectile
gross.
vomited by
Me
my
too.
child, like on me, and I projectile vomit right back on him. And it is a
Just back and
vicious cycle.
forth.
It is. It's so bad I can't do it.
Yeah, no. I've had a patient throw up on me before,
Me too.
and like,
yeah.
I had to finish doing what I was doing, and I walked out, and I was like, I really liked these scrubs, like it was like on Valentine's Day. I'll never forget it. Like, special needs patient, so cute, sweet little baby child. I was putting on like a high flow cannula, and like trying to explain, like, hey, we have to wear this, so I was like, gotta tape it to the face, and like, of course, like, I think that like mentally, like, we were delayed in some area, like maybe speech or something. I'm not entirely sure. I didn't get the full lingo. It was in the ER. It was like a quick like treat a neat situation, treat it, and then like they were gonna go up to the floor. Well, I was putting it on, and I literally was turning to like turn the settings up, and I turned right back, and I was like all down the front of me, and I was like,
Dude,
okay.
I've never been so freaked out when someone threw up
Like,
blood on me.
It went down everything. Like there was not a place that had not been touched, and I was like, I like walked out like a little, like a penguin, and I was like, can somebody get me some surgical scrubs? I'll be in the bathroom, and I need you to bring them to me because like I'm trying not to throw up myself. I'm trying to stay calm right now.
We used to have to wear like gowns. Like they'd have gowns set up. Did they do that in the ER or EMC?
Honestly,
like for traumas, like I would literally get so much
Gown.
blood on me. I'm like, I'm wearing a gown next time because.
See,
what would be like your PSA to anybody of like watch out? Like what is
don't stand in front of a trach patient. That's a blowhole, baby girl. It'll shoot I've seen a patient shoot a loogie.
All the way across the room.
Actually, I have a fun story, and if this nurse is listening, you know who you are. You know who you are, and single-handedly the funniest story. Like she's still traumatized. So we had a patient that had come in. It was like a fight or a gunshot. I'm not entirely sure. Jaw wired shut, so naturally we had to do a tracheostomy.
Okay,
they're in a C collar, which holds your neck stable.
Mm-hmm.
Well, we do like we downgrade trach sizes. Like it's, once they like start to get they've been on the ventilator, they've been progressing, we start to downsize it because they're about to like cut the wires and everything was about to start going back to normal. Yeah. Well, ENT was in there because they were just making sure that everything was still like anatomy wise because the gunshot was in the neck.
Oh wow.
So they were trying to make sure everything was okay. This ENT doctor, God bless her sweet soul, she was only worried about what she was in there doing. And so I'm changing out like the circuit and changing out like other things to make sure that they're good, making sure the trach, like the there's like a cuff on it to prevent like, if they throw up or something from that going down into your airway, making sure the cuff was like intact, lubing it up so that way like they can stick it in there like an easy glide. I'm doing my own little thing, living my best little life. Well, the nurse is in there giving some meds or something. And this patient, he didn't like her. Like we all knew, like he was just being a turd, young kid being a turd. Whatever. So we're in there and like the ENT takes a trach out. Patient is stable enough to where like we can do that and they're fine. I would like to clarify. And then she's getting the other one to put back in. She puts the other back in and she's holding it. And I'm like, oh, hey, I've got the trach ties and I'm coming over. The patient proceeds to cough like while the trach is out, so it's just a little stoma hole.
Oh. It's just gruesome as
no, this is literally like, I'll never forget this. Like it's like like coughing. And when I say that lug shot and hit the nurse in the face, I will never forget it. And I'm over in the corner like, you're trying to stay calm, and I'm like I'm trying not to laugh. And this is this nurse is probably one of the favorite nurses I've ever worked with. Like she is so like funny and like very like exaggerant with her moves. Like I literally she was like, and she just like stomps out and shuts the doors, and she's like, you can hear in the hallway, I quit. And I'm like trying to laugh, and the patient is just like gigging. So we knew it was a targeted attack. Like we knew because we always tell them like, hey, like watch where you cough. Like don't try to cough on anybody. It was targeted.
Because it will definitely go across.
Patient knew what they were doing.
Whoa.
Also, if like people want to go to respiratory school, if it's something you can't handle, don't apply. For school.
So if you're not good with blood, mucus.
Yeah.
I mean, honestly, we see it all because I worked in like we've done a bedside XLAP in the patient room. So like you were thrown to the OR right there and you're just like, okay, I am now anesthesia now. I've now switched hats.
Yeah.
Especially like we do a lot of conscious sedations to put like if they dislocate or if they break something, they're like putting it back in place to get ready for surgery.
Yeah.
Or if they don't need surgery or whatever. So if you don't like popping of like joints,
moving, rearranging.
Because we literally see all the things.
I did not just know this. Like I just like I don't know. Did you know this, Haley? Like I'm literally dumbfounded. I'm like, this is so awesome.
When we go to conscious sedations, they give a lot of like sedatives or like propofol or whatever they're using, ketamine, and so we're airway. And most of the time they have to be bagged for a minute because they want to make sure that they're loosey goosey for the reduction.
So okay, y'all mentioned you have to know quite a bit of medications. Yes. Why is that?
So like we give those medications for like we place an airway, and sometimes those meds, since they do sedate, they do suppress your cardiac function.
Okay.
So like no, like it's very helpful. Like, yes, the nurse does it. Yes, the doctor orders it. But sometimes, like,
it suppresses their respiratory. Like, they'll just stop breathing.
Right. And sometimes it's really nice to know, especially like if you're having new residents or like you have a newer nurse, to be like, hey guys, we might need levo in the room just in case. Just in case they kind of want to, you know, their heart wants to stop on us a little bit.
They give these
you know?
like sedatives and it like drops their blood pressure.
You get it nice and calm.
Especially when we intubate, we're using a sedative and a paralytic, meaning that they paralyze them. And so, a lot of times it does drop their blood pressure. And then as soon as they push those meds, we know like, okay, we need to bag because they're not breathing on their own anymore. So we're very versatile in the medicine.
Right. Or like, so like PEEP is something that we use. It's like the amount of air that's kind of left in after exhalation.
Okay.
And we can go up on that number. Like, but it's knowing your meds, like knowing like kind of what the nurse has, like what she's got on board really helps you out, because you're like, okay, can I go up on my number? Like, do we have pressures on board or do we not? Because if we already kind of our pressures on the softer side, then me going up on that PEEP, it really contracts that heart. And we're putting a lot of pressure on that heart that already is kind of like at like a not in a good spot.
Yeah.
If we have pressures and stuff like that, we have a little bit more room to work with our ventilation modes. So that's kind of like where our cardiac meds.
We let them like, in order to get off of a ventilator, we have to do what we call spontaneous breathing trials. And of course, they don't need to be on any sedatives to do that. We need to make sure they can breathe on their own. So we need to make sure all the medicines are turned off, all the sedatives, everything. So, but also if they're going to go do a procedure, I'm going to ask them like, hey, did you put the propofol back on? Did you take it off so I can put it back on SBT trial? So we have to kind of know. And then sometimes like we have a BiPAP patient who's being kind of crazy and combative. And then we, you know, they might give a little bit too much Versed or something, you know. We would make sure that if we know that if they're giving them something, so if we walk in and they're not breathing very well, we know why.
Yeah.
Or like sometimes they're nighttime meds. But sometimes, like, you know, patients take, you know,
like
something to help them sleep at night.
And
Seroquel. I don't know how many times we've answered a rapid response because the Seroquel hit a little too good, and the patient was like, like zonked. We're like, oh dear, like, pop.
I think it's just
really
like
love that Seroquel.
Every medicine that the nurses use affect respiratory drive.
Yeah,
everything.
Yeah,
but I mean, even morphine, something as simple as just like a quick pain med, like does the same thing.
So what is your favorite like specialty and area to work within? Is it in trauma? Is it in
ICU and trauma and NICU? Yeah.
I think my favorite place I've ever worked was the burn unit.
Really?
I felt that was the most rewarding place that I have worked thus far.
I really like NICU right now, but I'm definitely a trauma
The tiny
ICU.
humans scare the ever-living bejesus.
And here in Abilene, we like we cross-train everywhere.
Okay,
not every
that's
hospital's like that.
Yeah.
They have like specialty core groups where you stay in that area. Here in Abilene, we work everywhere.
That's
like
awesome.
You have a different assignment every day.
So you still have a different assignment, but like I avoid the tiny humans. I'll do pediatrics.
Okay.
I do like
pediatric ER. Loved it. Those
I wish
kids
I could
are
work
fantastic.
at Cook Children's. I wish, but
wait, Alexa, I'm curious. Why the burn unit?
So like,
gosh, I don't know if I'd want to work in there.
I don't know how to explain it, but those people, they have gone through literal hell.
Yeah.
You know, they are fighting for their life every single second. As soon as they would hit the door, it was a fight. And those patients are either really resilient or they're not. But like, it was more like, yes, we give one-on-one care, but I felt as if like we were there and got to, it's very rare that like as respiratory therapists, we see their growth and change throughout an extended period of time. Yeah. Typically, we treat them in the ER, we take them to a unit. You may not work in that unit for a week or so. You never see them again. You don't know what happened. You know, you only have that little moment. Whereas like in that unit specifically, it was a little bit on the smaller side. So we had one-on-one care, and like we were there through just about anything. Like we would take them to like the tank room where they would have to get cleaned. And that was a very gruesome experience within itself. But we were there with PTOT because sometimes while they were working with them to try to like, because like when they do get burnt, like we have to continue to stretch the skin out so that way they can have mobility. Yeah. So sometimes you're in there for that, you know, to like make sure that their breathing is adequate. And then like taking like breathing tubes out, or like bronching, which is where they stick that little camera down a breathing tube so we can kind of see kind of like, is there secretions, or like kind of like how are the lungs doing? I felt like I saw stuff that like I had never learned in school.
Mhm.
I feel like a lot of the stuff that we had learned was like you were learning like right there, right now. And the physicians in which I worked with were absolutely phenomenal to where they were
The
like,
physicians were really good there.
they would explain. And it was a very like, everyone collectively came together to like talk about these situations. And we were a team. There was no I in team. Nobody was doing something more than the other. And you're just there with those patients. Like I created friends with them. And then like we, at this facility, we had like a burn camp to where like you would see these patients come back and we'd have like a little camp for them.
Yeah,
to
they
show,
do that with, here in Abilene with the NICU reunion where NICU patients come back.
to where like we
yeah.
we would do it like at like a park, and we'd show them that like just because this has happened to you, like we want to see you thrive, but like you can still like go back to a normal living, like, and it's just
That's
and you get
awesome.
really like I felt like I got closer with the families in those aspects because like every single second was completely different, and it was treating those patients was not like a normal of anything else. Like whatever mode worked for that patient, the next patient that also had the same burn, that might not have worked for them. So like every single situation was absolutely different. And it was slight tweakings to make sure that they were like okay, and then like just kind of seeing it through and being able to be there with speech pathology, you know, to hear them talk, because most of the time when they're intubated for burns, it's months.
Yeah,
you know, that like we're able to months, or sometimes it is just a short amount of time, but for families to be able to hear their voice again, and we're able to like be there for that, and like
that's kind
sometimes
of why I
see
like
them
ICU
flourish.
care for that reason too, because
Yeah.
ER just like quick, get them stabilized and move on.
Yeah.
So that's why I like the NICU too, because our babies stay for a long time. They're there for months, and then you get to see them, you know, from little bitty, and then they go home, and like I've seen so many babies go home, and they're so big. I'm like, I can't even believe how big they are. Like I come back to work and I'm like, my gosh, like they grew like a whole pound, like literally gained that much weight. So yeah, I love the NICU for that reason. Same thing. It's like you get to see them. They were intubated for a month, and then now here we are.
Progress. That's amazing. I love that.
Adult ICUs like that too.
I love
Like you get to actually see their progress, not
Yeah.
just
Yeah.
they come into the ER and then you move on.
Yeah. Wow.
Overall, how has this career like changed the way you guys get life?
I mean, personally, I feel like I live it a little bit bigger.
Yeah,
I dance in the bar
too.
a little bit harder because I'm like, you know, every day's you can't get. It's not a get. You know, it's not granted. You know, like everything can be taken away from you in a split second, and like 9 times out of 10, when someone is, you know, on their deathbed, I've never heard them say, "I wish I would have gone softer. I wish I wouldn't have." It's always, "I wish I would have lived. I wish I would have done this. I wish I would have done that." Or, you know, sometimes if you're in there for like a comfort care, palliative, or hospice, doesn't mean that they're passing away right then. It just means that we're just going to let them go with grace. And sometimes it's an elderly patient, and they'll always be like, you know, you go live your life. Like, go live. Like, I wish I would have done that. And, you know, and I like, I think about it and I'm like, that is so true. Like, life is a beautiful gift, an absolutely beautiful gift. And I want to live, I want to do, I want to see, I want to do all these things.
I definitely
limit
wanted
myself.
to travel more, and I make the lunch dates with my grandparents.
Yes.
You never realize until I've seen so many grandparents just be ripped out of their life, and all they want are pictures and to spend time with their family. That's all they want.
Yeah.
And also, like, when I had my child, which was now almost 8 months ago, I don't even believe it, but when I had him, I've just felt like I have like taken that time and I have ran with it. Like, I don't even care that I make less money because I work less. I don't care because I want to spend time with him. I've seen so many people have stillborns and they went through the whole process and their baby wasn't even alive. I've coded several babies that did not make it. And so I just like, I don't know. I see so many people in the NICU. I literally had a hard time going back to work. I had NICU my very first day back from maternity leave, and I literally had to tell them, like, I don't know if I can work in there today. I just couldn't do it. I don't know. I couldn't see, like, my child and then go back to work and think of, like, somebody else who didn't get to go home with their kid.
Yeah.
Kind of sad.
But, I mean.
But, like, I feel like I appreciate him and, like, my family more now.
Yeah, because it's, you know, things that you initially when you're,
People
you know, when you're
literally
young, you
don't-
take for granted.
Yeah,
'cause,
they
you know,
really
you
do
don't
take
know.
it for granted, and then you come home and you're like, I have a healthy kid. They don't I mean, my kid had a lot of weight issues and stuff, but literally that was the least of our worries. It was something so small.
Yeah, where there's some kids that like they'll have a trach for the rest of their life because
or they're just like
you
failure to thrive or very medically complex. And my kid is running around being crazy right now, like, which is a blessing. So
yeah, you definitely start to appreciate everything a whole lot
made
more.
Postpartum a little bit easier because I was like, things could be a lot worse for me right now.
I always thought like things could so be worse right now.
It really could be. I tell I have a younger sibling, and she's a teenager, and I tell her all the time, like, things could be a lot worse for you. So I think it puts things into perspective for sure. Yeah,
absolutely. I love that. So, if you could give one piece of advice to anyone looking to pursue this career, what separates a good respiratory therapist from a great respiratory therapist?
Compassion.
But don't overlook those O2 checks.
Don't make up the respiratory rate, okay?
Don't make up the respiratory rate. Because I've had a student that was following me, and I was just on the floor that day. And in my head, I was like, this is going to be a cush day. I'm just going to, it was just a geriatric unit. Pops and mamas, love it, thriving, yapping all day, And, there was just one patient, and I was like, something just didn't feel right. So I kept constantly checking. And they had just pulled a chest tube the day before. And I was like, something didn't feel right. So I called my friend that was a rapid response nurse. That's strictly what they do is they look over like critical cases. They look over like the charts. They do like sepsis. Like that's just what they do that day. And I was like, hey, I'm getting a bad vibe. Like something doesn't feel right in my gut. And I had a student with me and she was like, like why? And I was telling her, I was like, respiratory rate has increased. Like these patients looking a little dusky. Like, and like, you got to think of like what's happened in the last 48 hours that's been different. Like even though they're on roommate, like something's not right. Well, everyone got involved, and turns out a pneumo had started to reappear in the patient and ended up having to put a chest tube back. But like in my mind, that was the most once again, a minute thing for me is like I was just attentive and I was just like really like looking at my patient. And then afterwards that student texted me and she was like, I just want to let you know that was the best day I've ever had. And I know that you just thought that was the most minute thing, but she was like, you really demonstrated to me like what kind of therapist I want to be, like just because it's a light load and you're like you were blessed with like a light load that day, or like you had like an easy assignment, like you still took it seriously and you still like really were attentive to your patients, and
a lot of people just get the job
made me
done.
want to be that kind of person.
A lot of people, like I know a lot of therapists that like they can do the assignment, right? Like they can get from 7 p.m. to 7 a.m. super easy. They can get the job done. But what separates people is how they care about their patients. Like, do they care enough to go back in there and check on them? Do they care enough to search through their chart and say, okay, like something's not right? Like she said, that's what separates people. It's like you actually can be human and like get down on their level. And I've cried with people before, you actually like care about these people. Not just, can I get through this shift?
Yeah.
And so, I think that really makes a difference. Just going one extra mile for them. Like, it really isn't that hard to like.
Because you have to understand, like, nurses and respiratory therapists, PTO, like, we see the patient sometimes more than a doctor does because they do have more patients. And it's not their fault at all by any means. But, like, they count on us to be, like, their little warriors on the ground to catch these things. Because, no, they can't be, bedside every single second of every single time. So, like, that honestly is like our sole purpose is to catch those little minute things before they turn into something bigger.
That's our, we work with the nurses.
Yeah, because like there's, like nurses do the same thing. Like they'll pick up on something, or I'll get a call and like, hey, I know you're not even like following this patient, but like something doesn't feel right. Can you come take a look? And you're like, absolutely, I'm on my way. Yeah. And they could catch something extremely minute, or PTO to be like, hey, we did a lap, but afterwards, something doesn't feel right. Any of us can catch a little thing, and it's speaking up and following that through that like changes the trajectory of that patient's stay. Like just a quick little something doesn't feel right. Can you come assess? Can escalate it to like we can cut you. Like we can deal with that right then instead of sitting on it waiting until it does turn into something really bad. So I think that like I feel like in any healthcare profession, just be attentive. Like even though it might seem the most dreading, or like you're having a bad day, like you have dealt with a code before. You do have to treat that next person that you see like they are your primary focus. Like that is Like you're the
Mhm.
first thing that they're seeing. You know, like really like grab onto that and just be like, it's gonna be okay. Like you can deal with your own personal stuff as soon as you walk out that door. But like they're your primary focus because they're there to get better. They're there to go home back to their families, just like
I
you.
think it's nice too. Like I try to drill into my students, like you need to rely on the different disciplines, just like how you
100%.
expect them to
Res-
rely on you.
And to respect you,
You need
respect
to go
them.
to other people and say, hey, you know, I don't know everything. Nobody knows everything. I think a lot of people come out of school very like confident and way too confident. There's never a dumb question ever. I have learned that being an instructor, actually teaching in a classroom, there's never a dumb question. Some people, everybody's on a different level. And so I think if you rely on the people around you, you'll be in a much better place, because I know you know this, but if my student asks me a million questions, I'm confident in them. If they sit there and don't ask a question all day,
I'm like that.
I'm terrified of them.
Terrified.
I'm like, no,
you are going to be licensed to kill. Like,
yeah. So
like,
that's like the
ask the
biggest thing is
questions.
like you need to like rely on people and ask questions, because there's people I've asked PT and OT stuff like, hey, what do you think about this? What do you think about this baby? What do you think about this adult? I've asked speech about stuff all the time. Like, hey, what do you think about this trach patient? Like, you just have to. You can't be that person that just knows everything.
right,
it
but
just
you gotta
doesn't work out for them.
We're just patient advocates. That's all
And
that we
and
are.
honestly,
Every
like,
single one is we are patient advocates. Like
we
if you think
rely-
something, say it, do it, or try it.
We rely on our rapport. You know how this is.
Oh, yeah.
We always joke that respiratory therapists are like the redheaded stepchild of the
Okay.
hospital, because a lot
the
of
middle
people,
child.
a lot
you
of
kind of
people
forget about
like
us.
they don't respect us, you know.
Yeah.
But like if you come in with like a learning attitude, and nurses and all the other disciplines start to respect you, and like your job is 10 times easier.
Yeah,
you know,
gotta
like
respect is earned. It's not always given. And I
Absolutely.
feel like a lot of people think that like it should just be earned. Like I graduated, I know everything. No, you don't. I still don't know everything. I've met therapists that have been therapists for 20 years, and they're like, listen, I see something new every now and again that I'm like, that was a new situation.
yeah,
Like be moldable, be a sponge, like
absolutely
be willing to try something. But also like on the flip side, like talk to your therapist. Like I feel like a lot of people just think that like we don't want to talk to you. We don't want to hear what you have to say. Like please come to me. Please ask the question, because like if you don't know and it's something weird or something strange, like let's figure it out together. Like
That's the
let's
main
figure out
reason-
something that works.
Yeah, like why I started working at the school. I was like, I want to be like, I want them to know what I know, and I want them to like, you know, I just wanted to be in control over what they learned a little bit more, because so many students were coming out like, I don't know if I don't feel like I can ask anybody anything. I'm like, no. So that's why main reason why I started. I was like,
I want them to feel better than how I felt.
Yes, I
graduating
want
school.
them to be better than how I was in school.
That's
Absolutely.
awesome.
Yeah.
Yeah.
And they have been. They're fantastic.
Like I want them to be better than me.
We have,
you know, like I
we
want
have,
them to be better.
We used to only have like 8 to 10 applicants, and now there's 20 in the new RT class here in
yeah,
LA.
the one in Lubbock, I think she had like 50. Like she has grown that program like astronomically, and that's like amazing to me. I'm like,
Yeah, because
we
we're
go
always
from, like,
short-staffed.
always short staff, but don't you worry, we're coming at you, you know?
Yeah.
But like, I just think that's awesome.
Yeah.
Like, I feel like every profession, especially I feel like healthcare is just growing like in general. I feel like a lot of people are really looking at it like in a completely different way.
Mm-hmm.
Yeah,
So,
that's amazing.
yeah.
That's awesome.
I don't know. I just want everyone to know like how awesome our job is, and that like we want to be respected just as much as we want to respect y'all. You know,
Mm-hmm.
like
Everybody wants respect. For
You know,
sure.
like-
That's like you realize
Right.
that.
Well, I mean, I can personally say like thank you guys so much for coming on and speaking about your incredible profession, because I had no idea. I'll be quite honest. I was one of the people that thought that you guys just did breathing treatments.
Yeah,
Like,
I mean,
and
like,
I'm so sorry that I did
I was-
that. But like,
But
I just
you
didn't
don't
know
until
Yeah.
you've
But it's
been in
okay.
a bad situation. Like nobody really knows.
Yeah.
yeah.
But
I mean,
thank y'all so much for what you do
Mhm.
for patients and the way that
of
you
course,
go the
I wouldn't
extra
have it
mile.
any other way.
Yeah,
No, I love my job.
Yeah,
that's awesome.
Even though I've questioned my job a couple times,
but,
but
we
I
all
do
have.
love my job.
We all have.
Well, thank y'all so much, and y'all tune in next time. All right, bye.